Welcome to our deep dive today. We're going to be talking about emergency airway management.
Okay.
Two procedures in particular. We're going to be talking about rapid sequence intubation and surgical cricothyrotomy.
I'm good.
So, obviously in healthcare, we're always striving for that first attempt success, right?
Right.
But sometimes we need a backup plan.
Absolutely.
And that's kind of what we're going to be talking about today is that backup plan.
Yeah.
What are the numbers? Like, how often do you think people are successful with intubation on the first try?
Yeah. So studies show that the overall intubation success rate is around 79%,
Okay.
with the first attempt success at 69%.
So about 1 in 5 intubations is going to require multiple attempts or some other approach.
Correct.
So let's start by discussing rapid sequence intubation.
Sure.
Can you explain what that is? When is it used?
So rapid sequence intubation, or RSI, is a technique used to quickly and safely secure a patient's airway,
Okay.
especially in situations where there's a high risk of aspiration.
Like when would that be?
So, for example, in cases of trauma, during surgery, or when someone is unconscious and unable to protect their own airway.
Got it. So what are the key steps involved in that procedure?
So RSI usually involves 5 main steps.
Okay.
The first one is what we call pre-oxygenation,
Pre-oxygenate.
where the patient receives high-flow oxygen. This is to increase their blood oxygen levels before any medications are administered.
Okay, so you're basically giving them a reserve of oxygen before you start doing anything.
Exactly.
Okay, cool.
And then next comes induction,
Induction.
which involves administering intravenous medications to induce unconsciousness.
Okay, so at this point, the patient is completely sedated, unresponsive.
Yes.
Got it.
Then we move to paralysis,
Paralysis.
where a muscle relaxant is injected to paralyze the patient's muscles,
Yeah.
including the ones that are responsible for breathing.
Okay, so that ensures that they remain still, and it prevents any coughing or gagging that could interfere with the intubation process.
That's right. And at this point, teamwork becomes crucial. A skilled medical team working in sync is essential for a smooth and successful intubation. And with the patient unconscious and paralyzed, the intubation itself can take place.
So this is where the endotracheal tube is actually inserted.
Yes.
Got it.
So the endotracheal tube is carefully guided through the mouth or nose and into the trachea, securing the airway.
Okay.
And finally, the last step is confirmation and ventilation,
Confirmation and ventilation.
where the team verifies the tube's placement and connects the patient to a ventilator
Okay.
for controlled breathing support.
Got it. So this step ensures that the patient's actually receiving adequate oxygen and that the tube's correctly positioned.
That's right.
Okay. So each step is crucial for the patient's safety and the overall success of the procedure. But, as we know, not every intubation goes as planned. So what happens when rapid sequence intubation is unsuccessful? What's the next step?
So in cases where standard intubation fails, surgical cricothyrotomy becomes a critical backup plan.
Okay, so surgical cricothyrotomy, that sounds a little bit more invasive. What exactly does that involve?
So surgical cricothyrotomy is an emergency procedure where a small incision is made through the cricothyroid membrane to establish an airway.
Okay, and so where is that membrane located?
The cricothyroid membrane is located in the front of the neck,
Okay,
between the cricoid cartilage and the thyroid cartilage.
that seems like a very delicate area
It is.
to be working in.
So typically, a surgical cricothyrotomy is reserved for life-threatening situations where a patient can't breathe.
So it basically provides an immediate airway
Exactly.
until a more permanent solution can be established.
Great.
Got it. So it's crucial. This allows the oxygen to enter and the carbon dioxide to exit the lungs. So it seems like, healthcare providers, especially ones who are administering those paralytic agents, should be pretty proficient in both of those procedures.
Absolutely. So while most healthcare providers are capable of performing successful intubations, there's always a possibility of complications or unforeseen challenges.
Of course.
And that's where preparedness and training come into play.
Right.
Ongoing education and simulation exercises are essential for building confidence and proficiency in both of these life-saving procedures.
What are some of the factors that affect the success rate of rapid sequence intubation?
Several factors can influence the success of intubation,
Sure.
including patient characteristics, the clinical scenario, and the experience of the healthcare provider performing the procedure. Research has shown that things like neck circumference, the presence of a beard, and a history of difficult intubation can be associated with a higher risk of difficult or failed intubation attempts.
Oh, wow. Okay, so it sounds like a thorough assessment of the patient is really crucial before you even attempt intubation.
Absolutely.
Yeah.
A careful evaluation can help anticipate potential challenges and improve the likelihood of first-pass success. However, even with the best preparation, there are times when intubation proves to be more difficult than anticipated.
And that's when having that solid backup plan, like the surgical cricothyrotomy, really becomes essential.
Exactly. Knowing when and how to transition to a surgical airway can be life-saving.
So we've established that both rapid sequence intubation and surgical cricothyrotomy are essential skills for healthcare providers,
Right.
especially those working in emergency settings. What are some of the advancements or innovations in this field that are improving patient outcomes?
One significant advancement is the development of video laryngoscopes.
Okay.
These devices provide a clearer view of the airway during intubation,
Okay.
which can improve first-attempt success rates and reduce complications.
So that's really helpful in cases where direct visualization of the vocal cords might be difficult.
Exactly. Video laryngoscopes have been shown to be particularly helpful in patients with difficult airway anatomy or in situations where traditional laryngoscopy is challenging.
Are there any other notable innovations in emergency airway management?
Another area of innovation is the development of new airway adjuncts,
Okay.
such as supraglottic airways.
Supraglottic airways.
These devices are designed to provide a temporary airway.
Okay. Without the need for endotracheal intubation.
Got it. So they kind of serve as a bridge until a definitive airway can be established.
Precisely. They're particularly useful in pre-hospital settings or in situations where intubation is not immediately feasible.
So looking ahead, what are some of the future directions or areas of focus in emergency airway management?
One area of increasing interest is the use of ultrasound guidance for airway procedures.
Okay.
Ultrasound can provide real-time visualization of the airway anatomy,
Oh,
which can aid in needle cricothyrotomy or tracheostomy placement.
that seems like it would make the procedures much more accurate and much safer.
Yes, it has the potential to reduce complications and improve patient outcomes. I think it's safe to say that emergency airway management demands a combination of technical expertise, anatomical knowledge, and a deep understanding of the psychological aspects involved.
It's a challenging but incredibly rewarding field where healthcare providers play a vital role in saving lives.
It's been a really insightful discussion. Thank you for sharing your expertise with us today. It's been a really comprehensive deep dive into this world of emergency airway management.
Remember, the pursuit of knowledge and the dedication to continuous improvement are essential for providing the best possible care for our patients.
You know, their lives depend on it.
Absolutely.
Thanks for listening, everyone.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.